Warren here, and I wanted to jump on here and answer one of the most commonly asked questions I hear from people when they finally sit down with me looking for help when it comes to their thyroid. And their question is always, is it possible that I have a thyroid issue? My doctor says everything looks okay. You know, when you have a thyroid issue and your thyroid is acting sluggish, it's really hard to just live life. You're weight loss resistant. You can't lose weight no matter how much you try. You're fatigued, just so exhausted. You're living on coffee. You feel foggy minded, like you can't remember things as easily, or you're not as sharp. I mean, you're seeing changes with your skin and hair. And so when you finally make that doctor's appointment and you get that lab work done, you probably in the back of your mind think, man, this is it. I'm going to get my answers. But a lot of times what happens is the doctors are not ordering the right labs, or they're not reading them correctly. So you leave that office discouraged and not really sure what to do. And even if you're on thyroid medication, I have so many people here in this office that have been on the same dose for decades and their labs look good. So is it possible for your TSH to look normal and there be other underlying issues when it comes to your thyroid? Yes, there absolutely is. And in this video, I'm going to talk to you about 2 different places that you can start looking within your labs to understand, are you really hypo and do you really have a thyroid issue that's going undiagnosed? So the first thing I'm going to say is that TSH is considered the gold standard. That's outdated information, and that is within medicine, kind of like the medical limits, the gold standard is TSH. In regards to functional wellness, that is not the gold standard. TSH is a hormone that comes from the pituitary. So it's a pituitary hormone. It's not a thyroid hormone. So a lot of times doctors are just looking at TSH. Number one, they're allowing it to go too out of control within medical limits. Or number two, that's all they're looking at, and they're not looking downstream. So let's look at those 2 areas. So TSH is going to come from the pituitary. It's going to go to the thyroid. It's going to tell the thyroid, hey, we need some more hormones. And so the thyroid is going to respond, and if it's healthy, it's going to respond the right way. And so what it's going to respond with is a majority of what it's going to produce is T4. Now, when you're looking at labs, you want to look at free. You want to look at your free hormones. You don't want to see what's bound up and not usable. You want to see what's usable right away. Your thyroid does make some T3 and T1 and T2, but we're going to focus on this free T4. So free T4 is inactive. This hormone needs to be activated in order to go to your cells and do what it needs to do. So there's so many people that are on T4 only medication, and the doctor is hoping in the back of their mind, by giving this medication, they're saying that your digestive system is healthy and your liver is healthy. Why? Because T4 has to go to the liver and it has to go to the digestive system. Yes, that's supposed to be the digestive system. I'm not an artist here, okay? So that is your digestive system. A majority of it is going to go in the liver, but then it's going to go there. And then it comes out converted to free T3. And free T3 is active. It's going to bind. It's going to go to the mitochondria. It's going to influence the cell. You're going to feel great. You're going to lose weight. You're going to feel clear-minded. You're going to feel happy again. You're not going to be anxious and depressed and feel like your hormones are all out of whack. But again, in order to get to that point, it has to be activated. So would it make sense to just check TSH and T4 if this is the hormone you want to see in your body at adequate levels? It doesn't make sense at all, because I have people coming in here when you have thyroid issues. If you are having thyroid symptoms, the majority of the people I'm seeing, not only do they have an issue in their digestive system, diarrhea, constipation, acid reflux, skin issues, but they also have a liver issue, because liver is our biggest detox organ. Liver is also where we store sugar. So between toxins and sugar, our livers get overwhelmed. So if we're not looking at this number, what I keep on finding, even with people that are taking Synthroid or T4 only medication, is their TSH will look good. Their free T4 will look fantastic because they're being medicated, and then their free T3 is low or low normal. Because if you're a normal, then you usually get written off as okay. But a low normal still does not work well for so many men and women, but especially women. So you have to look at your free T3 levels. Another area to look at, which is down here downstream from the pituitary area and the thyroid area, is that when your free T4 goes into the liver, a majority of what it's going to make is free T3, but it does make something called reverse T3. Now, reverse T3 is a storage hormone. This is a survival mechanism. Your body is storing up this reservoir of storage T3 in case of times of, stress and survival. You have it stored up just in case, and you can use it quickly. But the problem is that if your body is under stress, if you have cortisol issues, if you have iron issues, insulin issues, if your body is overwhelmed, what starts to happen is instead of making this free T3, you start increasing your production of reverse T3. It's saying, whoa, things aren't well out here. I need to start storing this up. But what does this mean to you and your symptoms if you're having hyposymptoms? It means that reverse T3 will now go. This is a cell, by the way. Free T3 was trying to go here, but now reverse T3 will compete with free T3 to get to the cell and to bind with those receptors. So if you have low normal free T3 and you have high reverse T3 and they're both competing to bind with cell receptors, guess who's going to run? Reverse T3, if there's more of it. So that's why it's so important to check your reverse T3 and to check your ratios of free T3 to reverse T3. And you can do that easily by Googling reverse T3 ratio calculator. I like the one from Stop the Thyroid Madness. So guys, this is two different areas that are very simple for you to see black and white that something is wrong. And it's not this TSH. It's later down in this system within your body. There's also thyroid antibodies that's going to be really, really important to look at, and minerals and nutrients. But hey, this is the first place. I'll be doing a video just focused on thyroid antibodies for you guys. So if you really enjoyed this video, or if you have a topic that you would like me to touch on, especially when it comes to thyroid or women's health, make sure you leave a comment and share.